My name is Ken Howarth. I live in Del Mar, California. I used to live in Orange County, and I was born in Blackpool, England. After I was diagnosed, it was a pretty scary time. I was 48 at the time, which was extremely young to have been diagnosed with the disease. I didn't really know anything about it, and but I was very scared, very worried, and I thought it was the end of my life as I knew it. I chose seed implants because I started to do my research, and I'm a pretty thorough shopper, and whenever I'm going to do anything big, and this was absolutely huge, I do a lot of research. I've worked in the medical business for most of my life, and so I know a few doctors, and I know where to dig into do some of the research. And I spoke with the doctor, my general practitioner doctor, first, and asked him, well, what would you do? And he told me he'd have the seeds. A couple of doctors that I played tennis with, I asked them that same question, well, what would you do? And they said, both of them said, well, I would have the seeds. So that kind of narrowed it down, even though I did have a couple of urologists tell me that the gold standard for somebody my age was to have my prostate removed. Urologists were telling me that, but my friends were not, so I chose to go with the seeds. In my prostate cancer, I was diagnosed in 2001, and I'm going to guess about August of 2001. I had just turned 48 years old. So that fall of 2001 and into the spring of 2002, when I was going through my research and talking to everybody I know and figuring out as much as I could about which is the best way to go. So that was 8 years ago now, just coming up on exactly 8 years this month that I was treated, and I never looked back. I didn't have any symptoms. I felt great. I was almost in denial for quite a while. Then I had to start working through my insurance company, and that was a challenge as well, trying to get multiple opinions, because I wasn't going to rush into this. Just the decision, what you do, was absolutely enormous. I was married at the time. I'd known a couple of guys that had prostate cancer and been treated, and their results were less than stellar. They were not what I was looking for. So I wanted to have an option where I wanted to get my life back. That's what I wanted. I just wanted to get my life back. I was referred to Dr. Doggett by a urologist in Santa Ana. Dr. Chamberlain was his name. And I had been visiting several urologists to find out what was the best course of action for me, and he recommended Dr. Doggett. I went and spoke with a lot of doctors that I had as friends, made visits out to UCLA to talk to their urologists out there, and ultimately decided that Dr. Doggett was the best guy to take care of me. I've had the seeds implanted. I've talked to people who've gone the other way and had their prostate removed and had other kinds of radiation therapy. I think, knowing what I know now, and frankly I have not kept up on the latest technology, but knowing what I know now, I would absolutely endorse having seed implants. My life is as it was. It's physically, I mean, it's great. I have no side effects, no anything, and I have my life back, and that's what's important to me.